diversity before and after the intervention. And so in figure A, you see that in the phage group, there was an increase in microbiome diversity from baseline to week 8, which we did not see in the placebo group. And this was a statistically significant finding. In figure B, we took the female responders from placebo and phage groups, and we looked at their microbiome diversity before and after. We just plotted before after. And in the placebo group in black, you can see that their microbiome diversity either remained the same or it decreased. Whereas in the phage group, their microbiome diversity almost uniformly increased, which is a pretty interesting and striking finding. And I just want to zoom in on one of the patients in our trial to show you how dramatic phage use can be on the microbiome and diversity. So on the left pie chart is this patient's before sort of microbial makeup. 75% or 3 out of 4 bacteria on their face were C. acnes in dark green. And after 8 weeks of phage application, this level had dropped by almost half. And that allowed a large bloom in microbiome diversity of the non-C. acnes and staphylococci, et cetera. Now, we know that people with healthy skin have higher microbiome diversity than people with acne. But another observation is, although we get acne at the rate of 85% of the population worldwide, there are some human populations where acne is either rare or completely absent. One such example is the Yanomami people in Brazil, but there have also been reports of hunter-gatherer communities in Africa and Asia where acne is extremely rare. The difference between their skin and ours is that their microbiome diversity is really high. And so given that diversity is a very important marker of long-term health, skin health, it's really interesting to see that the phage use can produce such a dramatic effect. And if we can keep this up and preserve a healthy microbiome, it can have really good effects on our long-term skin health.